These are 7 things I would not do since becoming a vet and since retiring. Hello, welcome back to my channel. If you're new, welcome. Click there to subscribe. Hit the bell to sign up for notifications. Then when you click that link directly in the box below, I can send you a copy of my free book. Number 1, vaccines. In my opinion, we've given way too many vaccines to our dogs, to our cats. We've been vaccinating our cats, our dogs for diseases, and the vaccines aren't really that effective. And that's caused some serious health problems. Vaccinating cats for things such as FIV, that FIV vaccine isn't really effective. Thinking about dogs, saying they needed, multiple vaccines every year for distemper, adeno, parainfluenza, parvo, etc., etc. You know what? That is way too many vaccines. Dogs with autoimmune diseases. There's a clear link between vaccines and the incidence of allergy in dogs. Are cats getting cancer from the feline leukemia vaccine, the feline rabies vaccine? Number 2, I would not be feeding this expensive veterinary prescription food. You can see the disclaimer there. It may not work. Pet food, it is a gargantuan business. And guess what? Like the companies that make this prescription veterinary foods, we're looking at some serious profits here. This is going to help your cat's urinary tract disease. But it's generally accepted now that dry cat kibble, it is the primary contributor to many of the cats that have urinary tract disease. They need moisture. What's in this? There is no moisture. In general, there are way better options to this. The expensive veterinary prescription diets, in many cases, are much better for your cat, for your dog. Number 3, having to get a fecal test to test for these guys' worms. Honestly, if I'm wondering if Murray has worms, little Tula has worms, I'm just going to suggest you go pick up some of this Panicure. You can treat your dog or cat really inexpensively with this. With Panicure, it's very safe, virtually no side effects, and you don't need to incur the expense of a fecal flotation. Number 4, would you like fries with that? Beware the expensive upsell. You need to remember that being a veterinarian or in a veterinary practice, that's a business. Part of the principle of business is make a profit. One of the ways to make more profit is the upsell. Would you like fries with that? Not just the burger. One of the more lucrative upsells could be the dental scale and polish. Little Fluffy is in for her annual exam. Your veterinarian lifts up her teeth, sees a little bit of gingivitis. Little Fluffy, she's going to need a full dental scale and polish. But does she? Dentals can be very profitable. They can easily exceed $1,000. And most of this can be done by auxiliary staff, say by an animal health technologist. I'm not saying that your dog, your cat, they're never going to need their teeth cleaned. Maybe they do. But if you're looking at mild gingivitis, really is mild dental disease, maybe they don't need to get their teeth cleaned. Maybe this is more an upsell. So you just need to be aware of that. Because in my opinion, not every dog, cat's going to need to get their teeth cleaned every year. Number 5, diagnostic tests. Little Tula's gone in for an exam. She's 8. I think we should do a full blood panel on her, including urinalysis. A little bit of a lamp. Maybe we should book her in for an x-ray. I think I hear something a little bit abnormal on her heart. I think we should maybe look at doing x-rays. Let's follow up with an ultrasound. Obviously, diagnostic tests are important, especially if your cat, your dog, they're sick. Like they're trying to figure out what's going on here. But really be leery about going down this kind of diagnostic jungle and pathway. Because you test for one thing, you're like, oh, the liver enzymes are slightly up. Maybe we should be doing a liver biopsy. Like it can go on and on and on. You may be doing tests unnecessarily on your dog or cat. Maybe be exposing them to things they don't necessarily need. So you got to really be thinking and asking these questions like, Murray, do we need to be doing that diagnostic test? And if we don't do that test, like what are you going to do for treatment? Maybe you're going to be doing the same thing. Maybe you're still going to be treating my cat as if he's been bitten and he has an infection and be giving me antibiotics. Then maybe go ahead, just give me the antibiotics. Don't do the blood test in the first place. My point here, way less diagnostic tests. Number 6, when to see the vet, when not to see the vet. There can be serious pet emergencies. Say your dog is vomiting every 30 minutes, possibly he has bloat. Your dog needs to see a veterinarian as soon as possible. Sometimes I saw this in practice. Clients had seriously sick animals and they were waiting at home like, I'll take them in sometime. Then often if you wait that long, it's too late. My point there is don't wait if you suspect your dog or your cat, they have a serious emergency. On the other hand, say your dog's been straining, you see a little bit of mucus, you see a little bit of blood in their stool. It's possible that your dog has a little bit of colitis. The stool's a little bit red, you rush off to the veterinarian, get all these diagnostic tests. It's quite likely your dog has eaten something, some type of dietary indiscretion. It's caused a little bit of inflammation in the colon. Hence a little bit of colitis. Happens to people all the time. Guess what? Also happens to your dog. That's an example of when you wouldn't need to rush in and see your veterinarian. My point there is knowing when to see your veterinarian. Serious emergency, you've got serious clinical signs, get in and see your vet. Something pretty mild, your dog is still pretty bright, alert, and reactive, aka little Tula, a little bit of colitis going on, then obviously then it's fine to wait. And number 7, this is a good one. You need to be questioning your veterinarian. And this one I can fully attest to. Yes, as a veterinarian, you know a lot, but you know what? You don't know it all, and sometimes you're wrong. Gasp, even I was wrong at times. I know you're suggesting I use this prednisone for my dog who has allergies. Well, couldn't I be using this bioactive quercetin? A lot to know in veterinary practices, right? You got a couple species. We have dogs, we have cats. And we have all these new and upcoming diagnostic tests. We have diseases that are changing. We have treatments that are changing. Then on top of that, there's all these alternative options. There's no way one veterinarian is going to be on top of all of that. So you, as the pet parent, you need to be questioning your veterinarian. And that's, one thing I would always encourage you to do. Meaning, I would never just go in and see my veterinarian and take his or her word for gospel and not question it. Thanks so much for watching this edition of Veterinary Secrets of the 7 things I wouldn't do since becoming a vet and since I've retired. Click up there to subscribe. Hit the bell to sign up for notifications. Then when you click that link directly in the box below, I can send you a copy of my free book.